Hey everyone, it's Dr. Kelly, your holistic health nurse practitioner. Today we're talking about how to resolve your heartburn. This is such a common issue. I hear people complaining about it all the time, and I'm constantly giving recommendations to resolve the heartburn. So today is going to be some quick tips to give you the information that you need to start to change that GI tract. Know that you can always get more information, more videos at drkellyfelmer.com, and please follow me on YouTube as well, Dr. Kelly Felmer. So the tips that I'm going to give you today, you're going to find links to these products and resources on drkellyfelmer.com. So be sure to go there when the video is done. So what we need to talk about first are the causes or the reasons that you're having this heartburn, this reflux, this belly pain. And you need to accept the issue that it has something to do with your food. It has something to do with a magnesium deficiency, and it also has to do with how well your bowels are moving daily. Okay, so let's talk about that last one first. I know we talk about this a lot, but think about the GI tract. Your complaint is right here. You're having a problem between your esophagus and your stomach, and the stomach resides right here underneath the left-sided rib cage. And so whenever a little bit of that acid leaks up into that esophagus, it hurts because the acid's not supposed to be there. But let me get this out there right away. Antacids, the Tums, the Maalox, the Prilosec, the omeprazole, the Pepcid, the Zantac is not the cure for heartburn. It may help you with your symptoms, but for those of you with a really bad problem, you've already discovered that it helped at first and now it doesn't anymore. Heartburn is not because of too much acid, okay? Heartburn is caused because the acid from the stomach leaks up here, and that hurts. The best way to resolve it is to get the fluid going the correct direction, and that's what we're going to talk about. But first, you got to clean up your diet. You need to start eating better. Spicy food is going to aggravate it. Alcohol is going to aggravate it. Does it mean you can never eat those things again? No, but if you want to get your heartburn under control, you need to stop them for now till we calm down that inflammation in the GI tract. We protect the esophagus a little bit, and we make sure that hot acid is going in the right direction towards the liver and then the small intestines, okay? So foods are often a culprit. If you're getting heartburn at night when you go to bed, you're eating too late at night before you lay down flat. That's part of the problem. Too many carbs, overeating, poor digestion, alcohol, tons of spicy foods. All of those things will make your heartburn worse. So for now, stop doing it. The next level of food changes involves food allergies. If you're interested in getting your foods tested to find out what common foods am I eating that irritate the lining of my GI tract, that irritate my body, I encourage you to take my food testing course. You're going to find information on that on drkellyfelmer.com. There's a nice little video about food allergies, and it'll take you to the link to learn more about the food testing course. So that's an option. But in the meantime, get rid of the alcohol, stop eating so late at night, stop overeating. You need to slow down when you're eating. You need to chew your food and let your food settle in your stomach. When you overfill it, the body's trying to digest it and it's rejecting some of it. That's the problem. So stop overeating. That's going to help tremendously. Now I'm going to throw this out there as well. People who have severe abdominal pain, and I meet teenagers with severe abdominal pain, I meet adults. The best thing when your belly is hurting you so much is to not eat. It'll let the stomach settle down. So just keep that in mind. If you're not hungry, your belly's been hurting you, take a break from eating and it's going to help you get over that hump. Okay? So food and alcohol is the first problem. The second issue is actually magnesium. So I talked about where your stomach is right here, where your esophagus is right here. And there's a connector right in between there. And magnesium plays a huge role if that little connector is going to leak and let that acid come back up in your esophagus, or if it's going to stay closed. It's only supposed to open when you're swallowing food so food can get into the stomach. And then it's supposed to close up tight. If that stays closed, no acid is going to leak up into the esophagus. You need magnesium. I guarantee that if you're having a heartburn problem, in addition to the food issue that we just talked about and the overeating and eating too close to going to bed, magnesium is the next problem because magnesium plays a huge role in keeping that closed. So the easiest way to start getting magnesium in, and we can take care of two issues at the same time, go to drkellyfelmer.com. You're going to see Natural Calm. It's magnesium citrate. It's a powdered form of magnesium that you put in water. You let that dissolve and you drink it. Tastes great. Easy to take. Just make sure it's all dissolved before you swallow it. That's going to start to increase your magnesium. And it's also going to get the bowels moving a little bit more. So the third piece of the puzzle here is that the bowels have to be moving. Every single day, at least once a day, the bowels need to be moving. That's normal. Do not tell me that, oh, I go every other day, I go every 3 days. That's normal for me. That's not normal. If you're having heartburn and you're not emptying those bowels well every day, that's part of the problem. Start taking the Natural Calm, which is magnesium citrate. It's going to help the bowels move, and it's going to start to replenish your magnesium. Now, on my website, drkellyfelmer.com, there's also another source that I really like, a liquid form of magnesium that will not affect the bowels like the Natural Calm. But most of you right now, you need the Natural Calm to get the bowels moving better. So getting you pooping really good will help this heartburn issue. Okay, but when you need and when you're ready for even more magnesium, the Remag is an ionic form of liquid magnesium, easily absorbed, high potency, and that'll really help you get out of that magnesium deficiency. So what are the things that we talked about? How are you going to resolve your heartburn? You're going to change the foods that you're eating and you're going to stop overeating. Don't eat so late at night. You're going to boost up your magnesium in the form of Natural Calm first, because that's also going to help you get pooping a little bit better. Now, one other thing that you can take to help with the symptom is aloe vera juice. You can get it at vitacost.com. You can get it at grocery stores. Taking 1 or 2 ounces a day will help to calm down the pain that you're having. But if we actually want to resolve the issue, what's the cause of your heartburn, you're going to change your food, work on the magnesium, and get the bowels moving. So good luck to you. If you need more help, you know how to find me, drkellyfelmer.com, and I will see you again real soon.